Hi everyone, welcome to our Unit 5 discussion here in SC 135. So today our topics will be lasers and ESU or electrosurgical unit. We're really going to focus mostly on like the safety precautions that go along with these because these two things can be pretty dangerous really if you think about it. So we'll talk about safety techniques and a little bit about how they're used. So our homework or assignments for this week include your discussion like normal. You do have a bit of a research paper on fire safety and ignition sources in the operating room, and then you realize it's like normal. So don't forget to go back and respond to your peers for full credit and putting in those APA sources. If you have any trouble with how to cite something in APA, please reach out, okay? All right, so did you know that approximately 85% of operating room fires occur near the head and neck? So a lot of people, I think normal people, people that don't work in our field, are unaware of how serious fires can be in the operating room. That's not really something they are concerned with when they go under the knife, right? Or they're not thinking, oh man, what if I catch on fire? No, most of the time they're thinking, about the pain or, being put to sleep, those types of concerns. But operating room fires are very serious, especially ones near the head and neck. And that's because they are an oxygen-rich source. And we're going to talk about the fire triangle here in a minute too. So your role as a surgical technologist is going to be um, acknowledging what these risks could be and mitigating those risks. We want to make sure that we don't increase risks of fire for patients. So the first thing is the electrosurgical unit, or ESU, sometimes we call it that. A lot of times we just call it the Bovie or the Bovie machine because Bovie was the name of I don't remember if he was a surgeon or not. I'm guessing probably not, but um, created this machine along with a doctor, Dr. Cushing, which we have a lot of instruments named after Dr. Cushing, worked together to create this machine that helps burn tissue using an electrical current. So it's got the machine as well as a handpiece to generate an electric current, goes to the patient's tissue, and then the current is brought back to the machine. Okay, so the pencil itself, which there's a little picture right here, this is called a Bovie pencil or an ESU pencil that we call the Bovie, is considered the active electrode. This three-pronged part here gets hooked into the machine. Sometimes they're portable machines, sometimes they're already like on the boom inside the OR that's just there all the time. But it gets hooked up there by the circulator, and then like usually at the beginning of the case is when we need it. It has two buttons. Excuse me. Still getting over my chest cold, my pneumonia, whatever it was. These say cut and coagulate. I know you can't see it in this picture, but that's what it's going to do to the tissue when you press those two buttons. And it just changes how the electric current comes out the tip. Okay. So the current is going to come through cord from the machine down the handpiece and into the patient. Now, I know we're getting in this field not because we're electricians or anything like that, but just briefly, well, there's another picture of this in a minute, but the electric current goes through the patient, but also has to be returned to the patient. Otherwise, it would just be like getting shocked. That current has to have a way to get back to the machine. So that is called a Bovie or a grounding pad, the Bovie pad. So this little pencil, this ESU Bovie pencil, cauterizes tissue. It can also cut, but cauterizes tissue is usually what we use it for. So it burns tissue by using an electric current, in this case, not chemicals. Don't confuse it with this term coagulate. Okay, the term coagulate means to clot or blood is clotting. We are cauterizing by burning in this case. So the Bovie pad, like I mentioned before, it could look, a couple of ways depending on the brand or the company that your machine is. So there's a little picture of where you could put those. The grounding pad is considered the inactive electrode. The pencil itself is active. The grounding pad is inactive. It is the return electrode. This is how the current gets returned to the machine. This piece also gets hooked up to the machine. The Bovie pad is not sterile. So the circulator will put that on, usually after the patient's asleep, because this can be a little cold, so we don't want to startle them or anything. So after the patient's been positioned and put to sleep, we'll put the Bovie grounding pad on. So anytime you're using that Bovie pencil, you have to have a grounding pad. Have to. Most, I think, machines are set up to where the pencil won't even work if this is not also hooked in. It's a safety device. You don't want to accidentally shock a patient over and over again. Okay. So it returns that electrical current to the machine. We need to put this Bovie pad on areas of larger muscle masses. So like this is pictured here, the lateral thigh is very common. If they're meaty enough, maybe on the latissimus dorsi muscle, like the lats on the back side-ish area, maybe the upper arm, maybe even the calf if necessary. Um, and you always, if maybe you're free in the room and you're not sterile or scrubbed in, and you're helping the circulator, you always want to verify with the circulator if that patient has any metal implants. If they do, let's say this patient had a total hip, there's going to be metal in those implants. You cannot put a Bovie pad directly over that metal. So even if sometimes with our elderly patients they forget or it's just not in the chart, whatever, for some reason they don't tell you that they have an implant, but you see a big long scar down their thigh, pretty good indication that there might be an implant there, so I would avoid it. So always, always avoid implants. And you want it to have a good seal. So sometimes with our hairier patients, we may actually have to do some hair clipping and the skin can't be wet or sweaty. You're going to want to dry that off so it has a good contact on the skin. So here is the generator part. This is the part that those two things, the pencil and the grounding pad, get hooked into. They only go one way, so it's pretty hard to mess up. So these two buttons here, you see they're kind of like on the other pencil I showed you, were blue and yellow. They're cut and coagulate. Those are the two settings that you can adjust the maximum watts that are going to come out the end of that pencil. So 60, I think, is pretty average. A lot of our doctors use 60 as a setting. Sometimes it's 30-30. Sometimes they want 45 cut, 60 coag. So those types of things are often on your preference card. If you have a good preference card, you can have that ready for your surgeon and your circulator ready to go for that case. So here are some other components. You might have foot pedals that the surgeon may need because there are other things like the Bovie. We used one in the nose as a collator that would have these foot pedals instead of on the handpiece. Or if you're using a bipolar, it is similar to the Bovie pencil in that you have current go through it, but you don't need a grounding pad. It looks like a forcep or a bayonet forcep if you've learned your instruments. So the current will go down one side of the forcep and back through the other. So you don't need a grounding pad for that. So you could hook up your bipolar here and use this single foot pedal for your bipolar. Bipolars only coagulate, they do not cut. Okay. So here is literally, if you're following the arrows, how the electric current flows from the machine, the Bovie machine, through this cord to your handpiece, your Bovie handpiece, Bovie pencil, through the tissue, whatever you're cutting or coagulating. That current will be picked up by this return electrode or the Bovie pad, placed over that meaty area, lateral thigh, and then through the return electrode back to the machine. That way they are not shocked, okay? So that's how that works. Now, when we're using Bovie, there's a few things we need to consider. We want to make sure that, kind of pictured here, we keep the Bovie pencil in a holster. It comes with a holster. It's a little plastic holster when we're not using it, because what could happen is if the surgeon or assistant, whoever, leaves that Bovie pencil up on the drape and maybe, trying to see or something gets sat on top of it and those buttons get pressed, it will, the machine will come on, right? And those drapes can catch on fire. So the drapes typically are what we call fire resistant, but they are not completely fireproof. So you can burn a hole in these drapes. I've seen it done. It's not pleasant, okay? You don't want to accidentally burn a hole in the drapes or potentially to the patient. It's a big concern. That's a sentinel event. So you also want to keep the Bovie tip clean. Every time that surgeon gives it back to you, make sure there's no built up burnt tissue on that. That can happen. Most of our Bovie tips are coated in that when you feel it feels like really smooth. So that helps prevent some of that buildup. It's called ESCHAR, ESCHAR. If you're using a non-coated Bovie tip, you might need a Bovie scratch pad, which helps keep it clean, which is countable. Okay. You want to keep the Bovie settings, like I showed you in that previous picture, as low as possible and still be effective. You don't want to, jack those the wattage way up if it's not necessary. Also, when you are, let's say, irrigating in an abdomen, okay, saline, your normal irrigating saline, 0.9% NaCl, is considered conductive. It will carry an electric current. So if you have your abdomen full of saline and you're trying to use the Bovie, anything that saline is touching will burn that tissue. So there are fluids, and you'll learn this maybe in another like pharmacology class or something, that are non-conductive. Okay, saline is conductive. There are things that we use in like the uterus if we're trying to distend it to see inside, but we still need to burn. We can use something like sorbitol or Hiscon. Those are non-conductive. Okay, but you still want to keep saline on your field. I know it's kind of counterintuitive. Yes, it's conductive, but it also will put out a fire. All right, so if you accidentally ignite the drapes, you have a basin of saline ready to go. Just throw it right on there, okay? So always get in that habit. Keep saline on your field always, no matter what you're doing. I prefer it, okay? So here's our fire triangle that I mentioned at the beginning. These are the three things that a fire needs to start. You have to have an ignition source, a fuel source, and an oxidizer. So I like this picture because it shows you specifically in the OR what those things could be. So be aware of these. Your ignition sources could be that Bovie pencil, a laser, a light cord, especially your fiber optic cords. Maybe you're using a laparoscope. The ends of those light cords can be hot. Some of the newer ones are not so much, but still take that precaution. Even drills as they're being used, okay? Oxidizer, obviously oxygen is a good one, but nitrous oxide as well. And then your fuel sources are like your alcohol preps. So like chloroprep. Anything alcohol based is a fuel source. Grapes, gowns, even the patient's own hair can burn. So if you're working near the hair, a lot of times they will put some sort of non-conductive gel in it and also cover it with maybe a wet towel or wet lab tapes, something along those lines. The ET tube, the typical ET tube is flammable. If you're working in the airway, anesthesia can use a different type of ET tube that is not flammable, which would be ideal. All right, so briefly here on lasers. Most people don't know this, but lasers is an acronym. It's not just a word, it's an acronym that stands for the light amplification of the simulated emission of radiation. That's a lot of things, okay? So it's basically a light that, light works in different wavelengths. So the laser is based on that wavelength of light. And tissue, your different tissue in your body absorbs different light waves. So that's how they use these. Some types of tissue, based on its color, may absorb those light rays, or it may be collected in that particular tissue color, and those cells would be affected. So it is very precise. I mean, look at the tip of this versus that Bovie. Very precise with minimal surrounding tissue damage. Different lasers are good for different things, and I'll show you some of those, I think, here in a minute. But we use lasers often to maybe cut out tumors. It does kind of do the same type of cutting, cauterizing tissue, cosmetics like, for example, spider veins, varicose veins in the legs can be treated with a laser. Eye surgeries, like the CO2 laser is pretty good for that. What else? We use CO2 lasers to take off genital warts. It's pretty common. Okay, so here they are. CO2 laser, OBGYN, condylomas, those are genital warts. All right, argon, like those skin lesions, cornea surgery, vessels, so it's absorbed by the red color. ND-YAG is pretty common for general. We use these pretty often for one of our doctors likes to use it to take off the gallbladder, doing a lap chole. So you can see that they have a little bit different things. These top 3 to 4 are your most common ones. The dye, laser, and eczema are not as common, at least in my area. So CO2, argon, ND-YAG are the 3 top common ones. Okay, so here's a brief video on a laser lithotripsy, using the laser to break up stones in, so it could either be in like the bladder, urethra, ureter, not urethra, probably ureter, kidneys. So that just shows you how a laser is used in action with those bladder stones or kidney stones. Watching them to me kind of reminds me of like something you'd see on Star Wars. And there's a sound with it too that just sounds like I don't know, it's just kind of funny to listen to and watch it break up. It's pretty cool. So laser safety guidelines, it's kind of similar to any fire safety. You want to make sure that you're using non-flammable solutions. All of those things allow prep solutions to fully dry, especially alcohol-based. The fire retardant ET tube, excuse me, and the right gases. You don't want it to be too oxygen rich. But with lasers, we also have to worry about eye protection. So lasers can bounce off reflective things, and if you're not careful, can damage your own eyeball. So we will use the correct eyewear for that particular laser. So not all lasers have the same eye protection. You have to make sure you have the right eyewear, right? Even on the patient, even if they're asleep and their eyes are taped shut, we typically will still just sit the glasses over their eyes in the case. Also, general safety, you want to make sure people aren't coming in and out. That could, inadvertently harm them if there is a stray laser beam, right? We always post warning signs on the OR door so people know before they come in. And if they have to come in, sometimes there's no way around it. There should be an extra pair of those laser safety eyewear hanging on the door for them to put on before they come in. And again, always have sterile water or saline on your field. And we always will use wet towels to like square up that incision site. So you don't really you're minimizing the chances of an OR fire. So if you have any questions about any of this, OR fires or lasers, please don't hesitate to contact me. You guys are doing a good job and keep up the good work. Bye.